Assalamu alaikum, welcome to my new video. In this video, I will discuss differential diagnosis of fever. A patient present with fever, constipation and relative bradycardia, we may think typhoid. A patient present with 3 weeks of fever, then 10 days free, plus arthralgial lymphadenopathy and history of contact with milk products, we may think brucella. Patient present with fever, tender hepatomegaly and feature of GIT upset like anorexia, nausea, vomiting and diarrhea, we may think amoebic liver abscess. Patient present with fever, chills, sweats, jaundice and traveling to endemic area, then we may think malaria. Patient present with fever, lymphadenopathy and history of dealing with cats, then we may think toxoplasmosis. If a patient present with night fever, then we can think tuberculosis, lymphoma, brucella or malaria. Patient present with fever, arthritis and UTI, we may think gonococcal or chlamydia infection. A patient present with fever plus strawberry tongue, we may think Kawasaki disease or scarlet fever. Patient present with fever, diarrhea and hemolytic anemia, then we may think hemolytic uremic syndrome or TTP, thrombotic thrombocytopenic purpura. A patient present with fever plus relative bradycardia, we may think typhoid fever. Patient present with fever, fatigue, lymphadenopathy plus bihilar lymphadenopathy, we may think sarcoidosis or histiocytosis X. A patient present with fever, low platelet count plus subconjunctival hemorrhage, we may think dengue fever. A patient present with fever, rigidity plus history of atypical antipsychotic within 1 week, we may think neuroleptic malignant syndrome. A patient present with fever, neck rigidity, photophobia, headache and agitation, we may think meningitis. A patient present with fever, headache, neck stiffness, manifestation of cerebral dysfunction like aphasia, convulsion, monoplasia or flexion of upper limb or extension of lower limb plus urinary incontinency, we may think encephalitis. Patient present with fever plus cardiac murmur and vegetation on echocardiography, we may think infective endocarditis. A patient present with fever plus high ESR more than 100, renal impairment and hypercalcemia in old age, we may think multiple myeloma. A patient present with fever, high CRP, insomnia, dry cough and shortness of breath, we may think COVID-19 or corona. Thank you everyone. Please subscribe and share my channel. Thank you very much.